I want to first of all say a few thanks. First of all, to all you really brave people for starting co-ops. This is not for the faint of heart, but I do think we need to inject some competition into the healthcare industry, and more than that, I think we need to inject some new ideas. And I think we've heard some themes today about this not only being financing, but if co-ops aren't about being a catalyst for really changing the delivery system, we have lost our opportunity. So thank you, all of you who have emphasized that theme, because I think if we're just another insurance company, then we're really not moving the ball down the field at all. I also want to thank John and Jan for the outreach to the National Business Coalition on Health. Appreciate that very much. And I do think the vision of a National Association of Co-ops is a very important one, because I think, as we've already learned this morning, we have a lot to learn from one another. And the notion of building a national learning network of co-ops around the country so we can really learn from one another, and we can also have economies of scale, as John started to allude to, in terms of, you know, some of the expertise that we're all going to need. So I think it's a great vision. I hope this is a signal of a lot more meetings to come. I hope 10 years from now we'll be in the big ballroom over here somewhere talking about the success of co-ops and how we've really met the vision. And third, I want to thank, even though she's not in the room, Barbara Smith with the federal office. Barbara has been a fabulous, I think, advocate for co-ops. She's been, and her office, very accessible. We've had a lot of interaction with her over time, and she's been very responsive, and I'm sure she's going to do a lot of cheerleading today. And as we've all heard too, hopefully she's going to bring some positive messages about federal support and subsidies and loans that are coming hopefully sometime in the fall. So I've been asked by John and Jan to just say a few words about the National Business Coalition on Health, our member interests in co-ops. And I do need to start with a little introduction of who we are. You've been introduced to one of our members, Jerry Burgess with Healthcare 21 in East Tennessee. We've been around for about a couple of decades, but employer-based coalitions have been around for even longer than that. And very simply, employers have gotten together in local communities to really, you know, very simply stated, Don Berwick states it this way with a lot of currency these days: we are supporters of the triple aim. Employers are interested in better health. Health and productivity of their workforce is a competitive advantage and a key business imperative for them. Two, we want better health care, and as purchasers and providers of health care services, as we've talked about already today, we need greater value and efficiency in health care delivery that we are paying for, and we need to lower costs. If we are going to be sustainable as business enterprises, if America is going to be a viable economic engine of the future, we have got to get a handle on health care costs. And the work at coalitions is very interesting. In fact, Jerry really described this to me well when he first hired me about 8 years ago. The role of coalitions is to do two things. One, it is to support individual employers in their own individual strategies to improve the health and productivity of their workforce, to reduce risk factors, to be value-based purchasers of health care, and all the strategies that an individual employer can put together to really move the market. But what coalitions also try to do, which is unique, is that we try to be catalysts for system-wide community-based delivery reform and population health improvement. We try to think that if we're only in our narrow box of our individual organization, and we're only thinking about our individual workforce, we are missing the boat in terms of our ability and in terms of understanding the community-wide influences on population health, on the health of our employees, and also in terms of delivery system reform. So coalitions think a lot about community-based reform activities. How can employers use their collective purchasing power and authority and leverage to really demand change and higher value in healthcare? And let me be honest with you, our track record is very uncertain when it comes to getting to that end goal. But that's what we're in the business of. And sort of like everyone that I've heard today, we're sort of idealists. We know how dysfunctional the delivery system is. We know how we can improve the health of the population, and we want to be a change agent for that. So again, I congratulate you all. The other thing that you need to know about NBCH is that we've sort of got a history in co-op-like organizations. A lot of business coalitions, including the one in Montana, really organized many years ago to bring employers together through group purchasing and also to develop alternatives to the traditional health insurance delivery system. And coalitions began to organize their own and contract with their own provider networks in their community. And so we've got a history of coalitions that have developed that model of organizing provider networks, doing direct contracting, trying to instill and generate more of a direct relationship with the provider community, and really be sort of the champions of their own destiny, not reliant on health insurance plans in their market. So you've probably heard of some of the history of the Buyers Healthcare Action Group in Minnesota, although their model has evolved. The Alliance in Madison, Rockford, Illinois, a very successful direct contracting coalition in Savannah, Georgia, Toledo, Ohio. We are in different communities around the country. But let me also say, in terms of the history of those types of coalitions, that there have been a lot of failures over time. And again, when I said this business is not for the faint of heart, it is very tough in terms of being successful in a highly competitive marketplace when there's so many issues that are brought to bear, including issues like risk selection. In terms of issues like competition from the health insurance industry. We hear from our direct contracting coalitions all the time that their competitors go to their employer members and say, we'll give you a deal over the next 5 years to bring you into our delivery system, into our insurance plan. Negotiating and picking off employer members based on almost deals that employers can't refuse. Yes, it generated competition, it generated a competitive response, but it's been very hard for a lot of coalitions over time to compete. So that is some of the history of some of our coalitions. Again, we've got 55 coalitions around the country right now, so most of our coalitions are not built on building their provider networks and doing direct contracting on behalf of a group of employer members, but that's still a viable model for 10 or 12 of our members. And when the legislation started and Senator Conrad started talking about this co-op idea, we were sort of quietly supportive, and when the legislation was passed, we did more research. We talked to Barbara. We had a conference. We had meetings and panel discussions at our annual conference. We tried to understand better where co-ops are going, and we were very excited, of course, to read the advisory committee's report, and particularly the recommendations out of the advisory committee that was so consistent with our own thinking that co-ops truly have to be a catalyst and engine for healthcare delivery reform. To me, that was one of the more powerful recommendations coming out of the advisory committee. So we took the advisory committee. We've had webinars with Barb Smith And we went to our members and said, who's interested, who's serious about at least exploring the idea of building co-ops in their own organization, or taking their existing model, direct contracting model, and thinking about the expansion of that model in terms of the co-op vision. And with Jerry Burgess' leadership, thank you, Jerry, we have established an affinity group within our membership of those coalitions that, again, have an interest in seriously exploring co-op development, either within their own organization or, as Jerry has described, not within the coalition itself, but help being a leader and catalyst for organizing a co-op as a separate organization. So we've gotten interest, as Jerry's already talked about, from Tennessee, South Carolina, Ohio, Wisconsin, Indiana, Nevada. Of course, we've already talked about Don Krevling and the Montana Healthcare Purchasers Coalition, the interest in the great state of Montana. And I think there'll be a few others as well, as again, we begin to get together and as an affinity group, we look at the guidelines that are coming out. I think there will be some level of interest in, again, putting together proposals for the planning grant in the fall. So that's just a little indication, again, of the interest within the National Business Coalition on Health. I think an important element of this, too, is certainly our association wants to be supportive in the advocacy efforts around co-op development. We are here in Washington. We do have a public policy agenda. We do want to think, as I'm sure we hit barriers and obstacles and the politics of healthcare delivery reform, I think it's important that we think about, John, a strong voice for co-ops as we move forward, because we know how perilous the political environment is right now. So we want to do that at a national level. We're encouraging all of our coalitions, even if they're not interested in co-op development, to be a voice in the development of exchange policy and to be a voice in support of co-ops as an important element of exchanges moving forward. So let's not lose sight of the advocacy agenda as part of the National Association development. So with that, again, I want to thank you for the outreach. I hope to learn a lot from you today. Co-ops are, again, not the core competency area within NBCH, because we've been so involved in broader healthcare system reform activities. But I do think, as all of you have talked about, and again I want to emphasize, if co-ops can really be agents for delivery reform, and as Jerry talked about, the notion of combining provider delivery reform for the active engagement of individual employees. There's so much that we can do in creative benefit design to create the right support mechanisms, the right incentives, the right peer networks that will be so key to achieving the outcomes that we want. And I continue, I mean, everyone calls me Pollyannish and a Boy Scout on this point. I continue to think, given the level of waste and efficiency and poor decisions that individuals are making, that we have a huge opportunity to improve health and healthcare and lower costs. And I think, to me, that is truly how co-ops in the future will be measured. So thank you for the invite.